Go live. Hello and welcome to another week of Core Balance Coaching. I'm Dr. Ryan Peebles, and we are here to do another open forum discussion. So I'm going to kind of let the chat questions determine where I go with topics and stuff like that. We do have one question prepared from the Student Hub. And other than that, I'll be addressing the chat, and I see it's already got some action into it, so that's great. And we will also be announcing the Student Hub Student of the Week, and also last week's, because I embarrassingly forgot to announce last week's, although they were recognized in the Student Hub, but I like to, acknowledge them on the stream and give them some credit for the contributions. So hello everyone, and thank you for being here, and hope you're all doing well. So yeah, like I said, no topic. I'm gonna go ahead and start reading the chat from the top, and if we get any good questions or anything, then I might tangent into a topic, and that's kind of how it's been going the last few weeks. And so it's been good, but maybe in future weeks we will come prepared with a specific topic. So we always take suggestions. If you have any, feel free to post in the chat and let us know what you'd like to hear about. All right, so let's go from the top. So Ashar Nakvi in the chat says, I want to know more about front anchors. How do I feel them if I'm doing it correctly? If you can speak about that. Yes, I can talk about that. Also, can you speak about posterior pelvic tilt versus anterior and how to keep balance between the two in daily routines? Yeah, that's a tough thing to do. I was talking about that, a similar thing yesterday on a podcast. I was a guest, and it was a really great interview on a really tiny podcast, but I had fun, and we may be making some of that content available for you guys. So the second question is about like how do you keeping a balance between anterior pelvic tilt and posterior pelvic tilt kind of means being in neutral, right? So how do you be in neutral? How do you maintain a neutral pelvis? And that's a really hard thing to do. There's no guidelines. There's no barriers. If you're in anterior tilt, you're in an extreme range of motion. You're all the way up against the ligaments, basically, that are keeping your pelvis from tipping even farther forward. So we'll call those guardrails. And posterior tilt's the same thing. So you're up against the back guardrails. But neutral, you have no guardrails. And I like the analogy of, going bowling, taking somebody, basically taking a child bowling and lifting up the guardrails, the bumper rails, and saying bowl a strike, bowl right down the middle. Is a really hard thing to do because you don't have the bumpers to, keep you, to tell you where you are. It's called proprioception, a body awareness that allows you to know where you are in space. So it's a hard thing to do. How do you do that? It's not an easy answer. It's kind of more like developing body awareness is the answer. How do you know where your body is? Well, it takes focus. It takes developing familiarity with your pelvis and the fact that it can tilt forward and it can tilt back. So you might want to experiment with those tilts. You got to, you have to know what the wrong thing is to be able to identify it. So that's why there is a lesson in the program that's just simply anterior tilt, posterior tilt, go back and forth and feel what that feels like, just so you can develop that awareness. We're not recommending that as a postural strategy. We are just educating ourselves, developing body wisdom. So to the first question you had, Ashar, how do you feel if you're doing the front anchors correctly? So yeah, this is probably one of the more challenging things in the program. Even though it's only module 2, it's very foreign feeling. It's not something that people typically do in their daily life. So getting face down on the floor, learning how to push away. So we're going to talk about the lower front anchor. You basically, you've got to know where your pubic bone is. You got to find it, and you got to know what it feels like to connect it to the floor. And in the beginning, you're going to have to most likely use your glutes, just squeeze your glutes, and that's kind of a little bit of a cheat to posterior tilt and get that pelvis, that pubic bone to touch the floor, and feel what that feels like, and then press into that pubic bone more. And you can use the glutes to cheat with that too. And the goal over time is to learn how to do that more so with the abdominals, the deep abdominals, all of the abdominals, and less so with the glutes. So it's not so much a posterior tilt to get there, but it's a shifting of a forward shift of the pubic bone and the pelvis through a strong abdominal connection. And you will probably also have some glute involvement too, but ideally they're the deeper glutes like the med and the min, not so much the max. The upper front anchor, it's a feeling, right? It's hard to talk about, but how do you feel if you're doing it right? This one, you're going to want to feel like your rib cage is already going to be connected to the floor if you're laying prone. So you're pushing away from it, and your upper torso, your shoulders and your head are going to elevate off the floor, and you want to feel that motion. The motion is coming from pushing the upper front anchor into the floor, or pushing away from the floor. You can think about pushing the floor away from you, or you can think about pushing yourself away from the floor. But the zone of your body that you're pushing away from is the rib cage, not your hands, or you're not doing a push-up with your arms, you're doing it with your torso. And so to feel that you're doing it right, you want to feel that motion is going through your thoracic spine, not your lumbar spine, and not your neck. And so you if you have that sense of, that sensation where movement is happening in your body, you want to really tune into that and feel that it's going through the thoracic spine. So you're not extending your neck, you're not arching your lower back, and you want to really dive deep dive inward into your own body and your body awareness. And you might have to spend a couple weeks on that. I've shared many times in the past, I've probably spent several months on just the front anchors, and we're trying to do it, when I was experimenting with this stuff long ago, like 10 years ago, we're trying to do it all in 1 week. That's kind of a lot to ask. So be patient and be persistent, and there will be a day, and it happens for most students, where you'll probably have a breakthrough with the front anchor awareness exercise, and it will click, and it will be like, aha, and you get to keep that for the rest of your life. That breakthrough is kind of like the riding a bike type analogy. You don't really forget it, and it's kind of an awesome thing. So learning how to move through the thoracic spine and through the hips and not the lower back, and it's through the push away. That's the goal. All right, so Marta, let's see how the chat's doing. Okay, so it's manageable at this point. Marta, we'll just say Marta. CBT provides hope. Issues with SI joint now in Module 2 Day True. Repeating routine 3 times a day. I love it. Yeah, that's good commitment. I'm going to go ahead and share. What I'm going to do is I'm going to share so that people can know what chat I'm looking at. So hopefully I can do this. And no, that didn't seem to work. Give me 1 sec, guys. Sorry. One more try. Trying to get the chat right here in this black spot. Oh, there it is. Haha. Okay. Now you guys can kind of follow along with me where I'm at in my question answering. All right, so we're at Marta. She says 3 times a day. For months I've been doing egregiously. My dad's name is Greg, so I saw that word in there. Squatting to the right to avoid bending knee with torn meniscus. Ooh, okay. Interesting. So you're kind of creating for yourself a compensation on purpose, and I don't typically recommend that. If you've had a torn meniscus in your knee for months, I think it's time for you to start challenging that knee and not avoiding it. So that's kind of a whole nother topic, but I will say that people, you can and should be able to live a fully functional life with a functional knee with a torn meniscus. And you know, there's certain types of tears that may be too severe, but you can work through that. And knees can be functional with a torn meniscus. I most likely have a torn meniscus in my left knee. I know I've torn it in the past. Maybe it healed. I didn't get another MRI on it, but my knee is fully functional, and that was through challenging my knee and getting it stronger gradually over time. It's the same thing we're doing with our backs. So that's number one. I wouldn't create compensations or like limp. I wouldn't limp on purpose and apply that to exercise. So cause of my back pain, have since corrected my posture, but PT says my hips still go sideways when I bend. Watch your videos on bending and following them. Going down feels like a stretch, but feeling pain on the way up. How do I fix this? As it seems like repetitive trauma still. Yeah, if you're feeling pain, then it most likely is still causing some kind of irritation. Yeah, that's the body communicating. Feels like all the progress I make in CBT gets reset when I bend, which is frequently throughout the day. Thank you. Okay, so Marta, you're not alone, and I want to tell you that there is a way for you to bend down with your hip hinge, right, from module 5, I believe, and grab something off the floor and pick it up confidently and strongly, and it could feel good for your back. And it's going to be just a matter of learning how to do that, and it's not like something you can learn by reading a book or watching a video. This is learning through feeling, learning through experience, experimenting with your body. And the way that I do it, and I know that sometimes I bend down and I haven't done it in what I believe is to be the best way, and it doesn't feel so great for my spine. And then I go, oh yeah, I have to be mindful. And then I'll bend down, same thing, same object, and I'll do it in a healthy way, and it actually feels good for my back. So it's not about what you're doing, bending down, it's about how you are doing it. Which muscles are driving the motion. And if you can figure out whatever it takes of your effort and work and commitment to core balance training and your body, how to have your abdominal muscles drive the motion of lifting up. Okay, I'm going to demonstrate, which I've done this many times before. I'm just going to demonstrate. I can't really talk while I'm doing it because the mic. So I'm going to bend down, and my abdominals are going to pull. My abdominals are lifting. Okay, and my glutes from the back. My lower back muscles are not really doing the work, and that's why it feels good. And those are that's probably the first time I've ever done a stream in shorts, but it's just really hot here, so normally I have pants. I forgot I was wearing my board shorts there. So that is abdominal and glute driven lifting, and notice it looks like I'm using my back, right? I'm not doing like a squat to avoid using my back. I'm actually not using my back. I'm hinging at my hips. Those are my hip joints. My L5S1 is not bending. My L4-5 is not bending. This is all hip hinging, and the motion is being driven by not back muscles. And back muscles are just hugging my spine. They're probably active. They're just not driving the motion. And so you can think about it. Like, I can bend my arm, right? And this doesn't hurt my back because it's a different joint and different muscles. Same thing with bending down. I'm bending, it's my hips moving, not my back, and it's my hip muscles, my abdominals are, they're driving the motion in a sense that they're just stabilizing my torso. And my glutes and hamstrings are providing the actual lift. So that's the best thing I can give you on a video. It's going to take gradual effort, gradual progressions, 1% improvements, and it's going to take a lot of persistence, and it's going to take patience to get there, but you can do it. That's what I want to tell you. So Stein, definitely a name I've been seeing and recognizing lately. Let's go back here. So we are here. I find it difficult to contract my glutes in the beginning of the bridge. Is it normal to go halfway up to be able to squeeze them? I wouldn't say that that's normal. I would say that most people are able to squeeze their glutes in the beginning of the bridge, or even just laying down. You can just squeeze your butt and crack the walnut between your cheeks, and I would say most people are able to do that. So work towards getting more motor control of your glutes in a larger range of motion. They may have some amnesia in that full hip flexed position with your knees up. It's called the hook lying position, the initial position of the bridge. Deep gluteal pain or possibly piriformis syndrome, will this program help? Well, I've seen your name a lot, Stein, so are you not already in the program? Yeah, this has helped with what people often think is like, this is a really common thing, is like, it might be piriformis, it might be, sciatic, it might be, you're bringing up deep gluteal, which is right there in the same place. People often don't know exactly what it is because it's deep in the hip. Yes, we've had success with students in the program. We just got a video testimonial from one who had this same thing and nothing helped. He tried all kinds of things, therapies, physical therapy, and the program was able to help. And I believe it's because we are just bringing more balance to the musculature around that area. So whatever is like spasmed in there gets to kind of let go a little bit. Those are my thoughts. Dave Dennis, I'm wondering about the use of Kegel muscles, the ones used to stop the flow of urine while walking. If I flex it, pelvis tilts a little and aids in getting into position. Am I onto something here? Yeah, you're definitely onto something. So the pelvic floor would be the Kegel muscles, is the bottom of the deep core. So if we have the Coke can analogy, the top is the diaphragm, all of the sides are the abdominals and back muscles, all the muscles around, and then the bottom is the pelvic floor, which Kegels, and it is a component in containing your power and creating intra-abdominal pressure. You love that pressure. You want that pressure. If the pressure leaks, like a Coke can with a pop topped, it has no stability. You can squeeze the can. So you want to maintain that pressure, and the pelvic floor is the bottom of the chamber. So what I've found is that typically there is a gradual improvement in pelvic floor function just by doing the back anchor. Because remember, the back anchor is not focused on any specific muscle. It's just pushing away from a healthy support zone in your body. And so muscle engagement results. And I found that there is some pelvic floor muscle engagement with that. It's natural, it's gentle, it's not extreme, it's not like a max Kegel. And that is enough to have improvement for a lot of people. If you bring in the pelvic floor as a whole nother element, it does seem to complicate things. And so I've decided consciously to let it happen more naturally and not say, okay, and now contract your pelvic floor on top of all the other things that we're already doing. But yes, you're onto something. And I've done a whole stream. Actually, we had a special guest. Her name is Lillian Francis Donner, Lillian Donner, doctor of physical therapy. She is a pelvic health specialist, so I recommend checking out that live stream on the YouTube channel. Just go to past live streams and you'll find it. And maybe a couple months ago, it was very good. It was all about this. Texas Wheeler, front anchor with big belly, chest. Feeling the anchors is a little harder. Okay, yeah, that would make sense. Any notes on how to know I'm doing it right? How much to engage and not engage the lower back, etc. to activate? Okay, let me think about this. You're having trouble feeling the rib cage on the floor. So we can bring the rib cage, bring the floor to the rib cage by placing a folded towel above your belly, so that it raises the floor, not where your belly is, but where your chest is. And I wouldn't imagine that much thickness is needed. Maybe just a folded towel, like as minimal as you need to be able to feel the floor with your rib cage, and then push away from that. So that's the modification that I would recommend with you. And then hopefully you can feel it better and you can know if you're doing it right. I talked in the beginning, one of the very first questions, how do I know if I'm doing the front anchors right? So hopefully you heard that. If you tuned in late, go ahead and start from the beginning. And I was talking about it there. And then how much to engage the lower back or not engage. We're not really trying to engage the lower back. So if it engages as a result of your pure intention of pushing away from your rib cage in the front, allow that. That's okay. We're not going for 100% or 0% isometric anything. We're going for natural, healthy movement. So we just go by intention. So we're intending to push away and extend through the upper and mid back, and kind of keep the lower back a little more out of this one. Keep it kind of quiet, but it may engage a little bit, and just be okay with that. So there's no hard lines here. And then get back to me with that after that modification, because if you can feel it better, you might have just a better idea if you're doing it right. And so try that and get back to me maybe next week or in the student hub. Just post about it. They can pass that along to me if that helped. Dennis, I'm at front anchors learning stage. So far, using the back anchors is really showing some difference when sitting. Awesome. Yes. I love when people apply the back anchors to sitting, even, starting in module 1 when we're not even, we're still on the ground in module 1, but you're a little ahead of the game and I love it. So good job. I have a bigger issue, scoliosis, squeezed hernias because of it. It's always double or triple for me to follow the instructions because everything is slightly crooked. The main question is, this approach course can help with scoliosis. Yeah, it'll definitely help, because scoliosis can be worsened if gravity is pulling you down. So you have a spine. Let's see if we do this. That spine right there. Whoop. Behind me, and you have a lot of gravity pushing down on that spine. These curvatures are going to collapse in one direction or the other. So if this is your scoliosis and that's a side curve there, then it's going to collapse more in that direction because of the weight of gravity pushing down. If you were to take a maybe like a string and lift up on the top of the guy's head and decompress him or unweight him, those curvatures would presumably decrease. And so ideally that's what we're doing in the program, is we are decompressing the spine by closing the chamber 360 degrees around of our core, and increasing the pressure in it through a strong core connection, our breathing, improving our posture, and so we can become a little taller. And so yeah, it will help with anything that's a result of the spine curves becoming accentuated. We kind of want to decrease the curves. We still want curves in the spine, natural healthy curvature, but the problem is they tend to become exaggerated. So yeah, it does and has helped people with scoliosis. Also, there's a point later in the program where we start doing left-right imbalances. We start addressing that directly. So at that point, you're addressing scoliosis directly. But before you do that, so in that sense, the program directly helps with scoliosis. But before you do that, you got to get front to back stability. So you're at the front anchors learning stage. Good job. Keep learning. It is harder. And I have talked, Yep. And you're doing the back anchors too and noticing a difference. So keep building on that. You're going to notice just more core activation, more engagement in your daily life. And that's going to help be the building blocks for when we later address the left to right imbalances. But you got to get that first. So hopefully that helps. NPE, neck topics. Okay. Yeah. All right. We'll put that on the list. Thank you, NPE. Core member there showing up. Shelly, should I do MET exercises since pelvis is always tilted the same way? Also, what if walking creates sciatica? So, yeah, I'm open to muscle energy technique, Shelly. Yeah, I think that's a reasonable thing to do. It's not something that you can do like in your day-to-day and maintain, but little things that can just help you along the way. So, yeah. And then I was talking about the side tilt pelvis in the coaching hub recently. You want to just pay attention in your day because most likely, like the body is constantly adapting and evolving to what we do with it, to our lifestyle. I sit a lot, my body's going to shape itself more to be like a sitter. I run a lot, I'm going to be more like a runner. I become a sprinter, I'm going to build more muscle for sprinting. So in your day, like there's probably something that you're doing on your day-to-day basis that's keeping your pelvis tilted. Because if not, the body would probably adapt to not having that need anymore. And this isn't 100% case scenario. Maybe there was something in the past and it needs a little push. But if you've been trying to give it that push and it's not happening, then there's probably something else keeping it. And oftentimes it's the way you sit, the way you stand. Do you stand to one side and lean on one side? Do you carry your purse on one side? Do you drive a lot? Because just driving is really imbalanced. It's the right leg is a lot heavier activity than the left. Waiting in line at the store, how are you standing? Are you paying attention to how you're standing? And if you have this tendency to always lean one way or sit one way with your leg crossed one way on the couch or whatever, you're just going to neutral might not be enough. In these cases, I think we need to overcorrect and to get to neutral. And so you might want to try doing it the opposite way for a while just to see. And if you know one side of your flank or torso is tight and shorter, let's say my right side is tight. Okay, this side is tight. These muscles are tighter. You want to imagine lengthening them when you stand. You want to imagine length going into them. So you want to apply that throughout your day. And it's hard work. It takes a lot of focus and commitment to that. But those are the strategies. Along with the exercises in the program, you want to focus more on the side that is more challenging, has less endurance, less strength. You want to do more work on those sides, like the single leg exercises. Which side is harder to stand on one leg and do the exercise? Do more on that side. So those are the recommendations. And MET is a nice just a little extra push. Gretchen's Vegan Bakery. How do you feel about kneeling chairs? Yeah, so those are like Scandinavian style chairs. I used to have one back in the day when I was in the cycle of back pain. And sitting was the most uncomfortable thing for me. I couldn't even sit I got one of those kneeling chairs, and it definitely helped. And I love the variety of it. So yeah, I think it's a good thing. I just wouldn't do it all day as my only chair. I would use it as another tool for variety. I'm a big fan of changing it up. And this workstation I'm at, I have probably 10 different ways that I sit or stand and work at this station, because the variety is the spice of health. So, Marcella, how to recognize between nerve and muscle pain? I'm getting a lot of pain when front anchor challenge and progression. I just realized I forgot to answer a question from above about sciatica with walking. I don't know why that popped into my head, but I don't want to forget about that. Where was it? Oh, what about it was just really just this question right here. What if walking creates sciatica? So that's going to be most likely, Shelly, I'm not going to say 100%, but most likely a stenosis type thing, because standing, walking closes down a stenosis even more. And so the program should really help with that. The program helps to open up a stenosis. So you want to remember pubic bone forward. And there's a lot I could get into with that, but there's also a lot of content that I've put out on YouTube and in the program about pubic bone forward. So I would triple down on that for if walking creates sciatica. Okay, so Marcella, back to you. How to recognize nerve and muscle pain? I'm getting a lot of pain when the front anchor challenge and progression. I feel pulling, but sometimes I'm worried that I pinch nerves. Okay, so the nerve pain is going to have an electric type feeling to it. So tingling, numbness, shooting pain, radicular symptoms like burning, coldness, cramping, spasming, and it can refer to areas that are like farther away in your body, like in your calf or your quad or your foot. But that's if a nerve is getting pinched. If it's local pain and it's just like soreness, dull ache, it could be sharp pain, but it doesn't necessarily shoot like a distance. And that's mostly more like a local tissue. And they're all nerves. That's what feels. But you're talking about a specific nerve that gets pinched, that goes down. I know what you're talking about. So you might want. So Marcella, I would recommend. It's probably also a stenosis type thing. I'm assuming by front anchor challenge, you actually mean front anchor awareness, because front anchor challenge is a very safe position. So if you're doing front anchor challenge and you're getting that, don't lift your legs as high. But you said challenge and progression. The progression is a progression of the awareness exercise. This is more likely to irritate a stenosis or spondy and pinch a nerve or something like that. So I would do a very thorough warm-up with the bridge, and maybe go for a walk and get your tissues nice and warmed up, and then just get into the front anchor awareness position and just relax and breathe into the floor and don't do much, and see how that feels. If you can get away with that, then we're good. It's about something about what you're doing and not just the position. So just try that first. One day, take a whole day and just don't do more than that. I'm not saying do it for a whole day. I'm saying doing it for 5 minutes one day. Then the next day is when you can say, all right, I'm going to try and progress this a tiny bit. I'll just try and push away from my pubic bone and just not even lift my legs, just push away, and my legs will feel a little bit lighter. They'll unweight a little bit, and they'll come back down, and I'll meditate and breathe on that and see how that goes. And so you're going to progress like that, 1% increments. That's the only way I know of how to push through something like that, because you got to learn how to. You have to be able to be prone, because that's the same thing as standing, right? It's your body is just straight. And you got to learn how to extend through your hips, because that's walking. And you got to learn how to extend through your thoracic spine too, because if you ever want to look around, you don't want all that motion going into your lumbar spine. So, and you don't want your posture to start curling forward. That's going to put more stress on everything. So You got to be able to be open, and it's 1%. Your body is an experimenting machine, and you have to learn through experience. Brandon, what are you feeling about tension myositis syndrome, TMS, from Dr. Sarno? I've talked a lot about this, Brandon. It's one of my recommended readings in the program. I agree with every single thing that Dr. Sarno says. It was a life-changing book for me to read. It didn't heal my back pain, but it was a bit of a turning point when I realized the connection between the mind and the body. And the only thing I disagree with Dr. Sarno is that he says that back pain is 100% psychological. The other end of the spectrum is Dr. McGill, who says back pain is 100% mechanical. I'm somewhere in the middle. I think there is a mind and body component. So I think that it's both. So those are my feelings. But yeah. Marcelo, while driving, I try to avoid it. I feel pinch and kind of shift when the bumps are going inside a parking lot. Any technique to avoid that? Breathing program, module 0, day 0 lesson. Breathe into your lower back. Create that pressure, that decompression right before you go over the bump, and also connect your back anchor on your seat. Use your seat backrest. Have it tilted all the way up. Don't recline, but better posture is more vertical, and connect your back anchor to your seat. How we doing? Am I going to be able to catch up today? So I'm at Asher, and I'm not catching up. So since I'm not catching up, I'm going to take a little break because I've been going for like 35 minutes on the chat, and pretty soon we're going to cap it off. So get your question in now. Oh God, Asti, you're always ahead of me until Ryan catches up. Okay. All right. Yeah, she's always ahead of me. So, and you guys didn't really listen. So, I will be a reminder to that there's a limitation, right? So there's some days I just can't catch up. And so I do my best. So I'm going to take a little break from the chat. I know I'm at Asher, and I'm going to, he already asked that in the beginning. Asher, I already answered that question. You asked that in the beginning. It's just going to be about body awareness. You got to find neutral, which is, you have no guidelines on how to find neutral. So you got to, I don't know if you must be in the program because you're here. This coaching is only for students. So the program teaches you neutral through the anchors. The anchors are neutral because the anchors are muscular engagement. They're muscular connection. When you're in anterior tilt, like full anterior tilt or full posterior tilt, it's no longer the muscles that are supporting your pelvis in its position. It's the ligaments. You're hanging on your ligaments. So when you engage and connect to something like the core anchors or some other strategy, the muscles are holding your pelvis in place. And that's somewhere in between ligaments, which is the two guardrails at the sides. So that's neutral. So keep going through the program. I don't know how far you are through. I think you might have mentioned it in the beginning, but I think you're in the beginning of the program. Double down, triple down on the anchors, and you'll find that that's a very helpful way to just be able to naturally feel like you're in neutral without having to like squeeze or engage or like wonder about it. So, all right, I'm going to take my little break. I'm going to answer this question, which is the hardest question I've ever received from my team here, who provides me some questions from the Student Hub. I only have one today, but I actually have to look up these words because I don't know them. So from Kimberly, thank you for the hardest question I've ever received. You say, I have 2 rare neuro diseases, tarlov cyst disease. So I don't know it, admitting that I don't know it, and I have to look it up. So these are meningeal cysts or perineural cysts, and they're found at the bottom of the spine. Okay, so I can imagine that. They appear in the roots of the nerves that grow out of the spinal cord. Shock or trauma of the spine or exertion can cause spinal fluid in the cysts to build up. Okay, so it seems like it's almost like a protective mechanism, maybe, of the spine. So we have a picture. That didn't go well. Let's see. I don't know if this will show, but here's some pictures. The white would be the cyst at the bottom of the spine. And I thought that I might have had one other picture there. So it's just showing the sacrum. Okay, so I looked it up. I have a general idea of what it is. And then the other one you have is adhesive arachnoiditis. And so I'm going to look that one up too, because I don't know that one either. I'll have you guys watch me. Adhesive arachnoiditis, and Google can hear me, so it just filled that in for me. So this is a relatively uncommon chronic pathological disorder characterized by inflammatory insult to the arachnoid layer of the meninges that leads to fibrosis. As a sequel, the arachnoid becomes abnormally thick and adherent to the surrounding layers. So it almost seems to me like this is very correlated with the tarlov cyst disease. It's a response in the body to create thickness, fluid, protection barriers around the nerves. The meninges, which is the layers around the nerves. So, okay, I have a general idea. Let's see if we can do this. I'm wondering if CBT can help. I had surgery for the disease in October 22, laminectomy in L5 through S4. Interesting. Okay, all the way down. Drained the cysts and wrapped them so they don't return. Then put me back together with a few clips, for which there is a 2 to 5 year recovery. That is a long time, but you can do it. I'd like to expedite that recovery. Yes, I would like to do that too. All right, let's see what we can do. Structurally, my discs and everything are else in good shape. Thankfully, you can walk. You don't take it for granted. You'd like to return to snowboarding, backpacking, mountain biking, dance, yoga, bar. Do you think this program can help? If so, where should I place my focus? This is a really good question. Let's see, we'll go full screen. I want to just, give you some credit, acknowledge you for, being grateful that you can walk and not taking it for granted. I think we should all do that. Let's take a moment right now. Like, I'm grateful that I have 2 working legs and that I can walk, and it's an amazing thing to be able to walk on these legs. So, Kimberly, thank you for the inspiration to just be grateful for what we have, and you got 2 to 5 years ahead of you. Hopefully we can make that on the 2-year end. And I do think, I don't know if anybody in the program has ever had these diseases, but they seem to me like an attempt of the body to protect. The body creates layers, builds fibers and fibrosis and even bony, growths like calcium buildup in areas like around the spine, is an attempt for the body to protect an instability, or it's a natural fusion when the body builds bone around the vertebrae. The spine is fusing without surgery. And so I could maybe just see these diseases in the similar category, where cysts can be a result of trauma, and then the adhesive arachnoiditis it seems like it's building a fibrous layer around the nerves to protect the nerves. So we're not going to be directly addressing the diseases, but we're going to be helping to support the spine, and that the spine includes the nerves that come out of it, the spinal cord and all of the nerve roots that exit the spine at every level. That is part of the spine. And so when we're supporting the spine with the muscles around it, we're taking some load off of those structures, and hopefully the body would feel like it doesn't need to do as much extra compensatory things like muscle tightening, bony growth, other types of protection. And I wouldn't, I'm not going to guarantee anything, but I wouldn't throw it out the window. I would put everything I have into this, as it seems like you're doing, Kimberly. And I think core balance training could be one of the things that helps you along the way. It would make sense if it helped. And I will also say that we've found over the years that core balance has helped people with things that we would have never expected. I just was perusing Reddit one time, and a guy shared something very interesting. I'm not even going to share it on here, but it helped him with a problem he had. And I would have never even thought, and the thought never crossed my mind, but it makes sense once you think about it. Just to improve posture, improve tissue function, improve pelvic floor function. So that's the answer. I hope that helps, and I believe with 100% of my being that you can get back to your passions: snowboarding, climbing mountains, dancing, and doing fun stuff like yoga. So yeah, and medical system says 2 to 5 years. I would not let that be your limits. I think you should let your body's communication to you be your guide for your timeline. Yeah. Okay, so back to the chat. Oh wait, no, I'm not going to forget to do the Student Hub's Student of the Week. So let's go back to this, and we will announce right now that Denise Skidmore is the Student Hub Student of the Week. So congratulations, Denise. We're recognizing you for your exceptional commitment to the program, selfless assistance to others. We really appreciate just all the helpfulness that you've provided to other students. We're going to honor you by adding a month to your membership. You have to do nothing. We will add a month from the back end. It's probably already happened. And then in the same breath, I want to acknowledge Quentin Woods, who was the Student Hub Student of the Week last week. And he was acknowledged in the Student Hub and was also honored with 1 extra month to his membership. However, I forgot to announce it on this stream. So Quentin, we're super grateful for just everything that you've brought to the Student Hub. We actually, one of our team members mentioned that you were like one of the best Student Hub students of the week that we've ever had, and it was like a mistake that I forgot to announce it because you've been really awesome. So, and it sounds like Denise has been the same. So the students of the week are just getting better and better, and we're stoked. And thank you guys, Denise and Quentin from last week as well. So that is all the slides for today. Not too many slides, and we're gonna go back to the chat, and I'm going to try and catch up. I'm going to see what we got. Kim Vidani. This is going to be the last. Kim, you're going to be the last person that I address today, because I already know that getting close to an hour, and I got a long way to go. So I'm at Sarah Knox. I have noticed when I'm doing the back anchor, especially when I'm laying on my back, I tend to tighten my shoulders and neck muscles along with my abdominals when I push away from my back anchor. Any suggestions on how I can prevent myself from doing this? So you're not alone, Sarah. I think I've written about this in the FAQ because it's been a thing in the past, and my explanation for this is that most likely this is your body's attempt. You have a goal, and your goal is to connect your back anchor and push away, and your abdominal muscles are supposed to do that, but they might not be strong enough yet. So your body is recruiting other muscles called accessory muscles to help out. And so if you do it at a high intensity, it's just going to bring more and more muscles to the party. And if you do it at a low intensity, you may not bring these muscles to the party, but you might not be able to accomplish your goal of anchoring. So you got to find a balance between the two. It's a constant dance that you're always going to be playing in this program and in life to find that balance. And my suggestion is to maybe be okay with a little bit of the extra recruitment until your abdominals get stronger for now. And then once your abdominals are strong enough to do it on their own, try to find that level of intensity where you can have the abdominals with their new strength do the anchoring without recruiting those new muscles. But you might need them right now. And so this is a long-term goal over a period of weeks to build your abdominal strength and reduce your compensation from those other muscles. And you're not alone. So yeah, we don't want that. It's a really good thing that you're aware of it. So that's a fantastic thing. That's huge. And we want to acknowledge that you have good body awareness. And this is a good thing that you've brought this up to yourself and to me, so I can try to give you a little guidance. All right, David Haynes, how can you get up from seated to standing without using your... I would imagine that that's not possible. So you have to use your legs, but what we want is for the origination of your movement to be in your core. So the very first thing that turns on is the deepest muscles of your core, and then the layers out from there out to your toes. And so the core is stabilized first before the levers, because that's all arms and legs are levers attached to your torso, pull on the torso. If the levers pull on the torso, if they engage first, which is a pattern that happens, then the unstable torso will get yanked, and usually there's some levels of the spine that take a beating. And so we want to stabilize first. The movement originates in your core, and then you can feel like that core centeredness, your powerhouse in your center, can drive the movement. But your body is one large synergistic thing, and everything works together, and we don't try to isolate movement away or towards certain things. I mean, yeah, we do want the movement to be more core centered and more core dominant, but we don't want to isolate it completely away from using your legs. These are phenomenal tools that you have. So I don't know if that is a joke question or not, but there's my answer. All right, Asti, thank you for the moderation. David, how do you get up from seated without legs? I already answered that. Clifford, I just completed Module 2. Core feels amazing. That's fantastic, Clifford. I have still been doing my regular no workout routine. Does that mean that you regularly don't work out? But focused on core engagement. Lower body, next day, my right hip is always tight and sore. Okay, so you're just sharing. It sounds like you're integrating core balance training into your regular workout routine. That's exactly what I want you to do. Listen to your body. If your right hip is always tight and sore, then you got to potentially make a change. What is that change? It could be reducing intensity. It could be reducing frequency. It could be changing the exercises that you could be doing, or it could be keeping those exercises the same, but changing how you do them. And that latter approach is what I've found to be most often the thing that is what needs to be done. So more application of what's working for you, which sounds like Module 1 and 2 are working for you. So more application of those skills to how you're doing lifts, and maybe that changes how you do the lift, and maybe your hip will handle it better. So yeah, cool. And let me see, we got David, can you show us how do you get up to standing without using legs? It's impossible. I don't know how to do that, David Haynes. I'm sorry. I know there are people without legs, like people who were not born with legs, or had their legs amputated, who can get up from a chair, but they are way more skillful than me, and I cannot do that. But I can do it by having my movement originate from my core. You just can't, you wouldn't be able to see it. It's more of a feeling, which is what makes this program so hard to teach, because I'm trying to teach people how to feel things. Okay, yes, I am in the program and it brings me hope. I believe in it 100%. That's fantastic, Stein. Thank you. Chonky Tonks, I love the name. That is great. I am 1.5 months into the program. My left side is very tight from the QL to my vastus lateralis. That's a good awareness of anatomy. And what are some possible reasons for that? My program is helping, though. Possible reasons for that are, it's not even just possible. I think it's most highly likely reasons would be lifestyle. So what are you doing in your life? I went into this a little earlier. I think this is what needs to be the next topic, is scoliosis, left-right imbalances, side pelvic tilt, because it's been coming up a lot. I've been talking about it a lot here and there, but I need to do one whole stream on it, one whole presentation. So it's going to be a lot about lifestyle. How do you stand? How do you sit? And there is something you're doing that's keeping that going, that muscle tightness going. And so body awareness, figuring out maybe if you favor one side and then overcorrecting for a while. The goal is to get to neutral, but if you're always like this, you want to overcorrect so that you can get to neutral, because just going from here to neutral, I don't find that it's enough. Sometimes you got to overcorrect to get to center. And there's a lot more too. It's just, I don't know that I can get into it today, but what I can tell you is there's something about the way you're moving through life or posturing through life that is contributing to those tightness. The QL to the vastus lateralis, you can consider that one chain. And so that connection is needing to be tight. Could be driving, could be and so changing lifestyle, changing the way you stand or sit or do things, or maybe just being left-handed for a couple of weeks, like switch the way that you do things. And then there's the whole other element of the way that you do, which exercises are you doing and how are you doing them? And so you want to take a certain strategy with the exercises. Imagine lengthening in that side. You want to imagine lengthening in that side when you're doing an exercise. When you're standing on one leg, lengthen that side, and it starts in the imagination, the intention. And I'm going to make it a stream, so that's my answer as well. I used to have SI nerve pain every day and now rarely feel it. That's fantastic. Progress. Texas Wheeler, you're welcome. Any thoughts on synovial cysts in the lower lumbar spine and CBT work? Really interesting, because I don't know if you asked that before or after the person who I answered from the Student Hub, but that's what that was all about. So those were my thoughts on that. And maybe you are the person. Maybe you are Kimberly, but very relevant if you were to listen to my Student Hub answer. John Spencer, Dennis Tolyarenko. I also have scoliosis, and what Dr. Rand said here has helped me a lot. I'm in Module 9 and doing much better. Stick with it. Hey, thanks for that, John. Really appreciate that. Really appreciate the support to other students, the encouragement. It's really important. The emotional, psychological component of getting out of back pain is huge, and getting a little hope. You gifted him a little hope, and that's fantastic. That's a really wonderful gift. So thank you for that. Sherry, my PT noticed more tone in hip muscles on my good side than on the injured side. Should I put more weight on my right foot when doing the bridge to help even out the muscle tone? The answer is yes. Absolutely, Sherry. That is like I would say that's becoming, if it's not already, a foundational concept of the program, You want to put more effort, more time, more focus, more energy into the side that is weaker, has less endurance, less stamina, harder to maintain good form, and that is especially relevant for unilateral exercises, single leg exercises, all the things in modules 8, 9, 10, and 11, basically. Marcella, you're welcome. Kim, I'm 4 days in the program, feeling some relief. I have oh, this is you, Kim. All right. So I totally addressed this question. 9 months into a 2 to 5 year recovery. Hey, look, you didn't even realize at this point that you were the only question featured from the Student Hub. But glad to have you here live, and I'm glad you were able to hear what I had to say. Brienne, I was always so curious how you felt about McGill versus Sarno. Agreed. Both have good things to follow. Yeah, both have been inspirations to me, Brienne. I'd say McGill was an inspiration to me in the sense that I kind of wanted to be like him because he dedicated his entire life to the spine and healing back pain. And so he was, one of the first people that I know of that did that. And so, and he's a genius. And Sarno as well. He's a genius, and they have completely opposite approaches. And so I love both of them. I've taken a lot. I've learned a lot from both of them. Yeah. All right, Kim, you're very welcome. And yeah, exactly. Yeah. Oh, man, I can't say enough. So Kim says, that helps. I don't listen to the medical system. I listen to my body. So, use doctors for what a doctor is supposed to be. And the word docere is the Latin form of the word doctor. And docere means to teach. So let doctors teach you, learn from them, and take from them what you need, and make your own decisions. Educated, informed decisions. And your body is part of that. Your body communicates to you. So yeah, phenomenal. I've seen, heard, and still do so much what is called iatrogenic effect from medical care, which is negative effects from medical care. And it happens all around, all the time. And it's way more common than I would have ever thought now that I'm in the system. Chunky Tonks, you're very welcome. I realize it's hard to answer with such little information, but we're going to do a whole stream on it, Chunky Tonks. So hopefully you can, I love saying your name, and hopefully you can tune in again. All right, cool. Hey, thanks for clarifying that, Texas Wheeler. And we have wrapped up another one. We went about an hour, a little more than an hour today. I am grateful for all of you that showed up. I appreciate you guys leaning into your health. It makes me want to lean back and help you as much as I can. And so I'll be back again next week, and I will be streaming from just south of the border so my background will look different. I will be just across the border in Mexico, in a very safe place with my family. And I'll see you guys then. So until next time, get down on the floor and connect to your core. All right. Take care, everyone. And thanks again for showing up for yourselves.